Together we stay united in social distancing to protect our community and our nation. May God bless Texas. Jai Hind. May God bless America. Thank you. Stay safe.
Welcome to Face Live Talk Show. Today I have Dr. Nisha Sundaragopal live from Houston. Hi, doctor. How are you?
Hi Rashmi ji, how are you? Doing good?
I'm good. When I see your lovely face smiling, I just forget everything. All the
Oh, that
stress
is
is
so
gone away
sweet.
when you are here with us on our show. Thank you so much.
Yeah, thank you, Rashmi. And this is amazing thing for us as doctors because we've been really working hard to take care of our patients. And whenever we come on the show live, it's been a different experience every time I be with you guys.
Of course, and it has always been great to be with you because you are a great support to our community. You have always been guiding. Of course, the dentistry thing is going on, and even you have guided us with the pandemic cooking also. That was a great tip for all our viewers, and they were very happy. And always, it's a great information because, as we all know, that teeth are a very important part of our body, and it's very, very important. Thank you so much for guiding us all the time. So, doctor, I just wanted to know, how things are going to be now after, the situation going on for the pandemic. So, please give some limelight on that, please.
Yeah, so this pandemic has put a lot of things so different to this world, and we've been making some good show. Sorry, it's my dog. We
It's
are at
fine,
home.
no problem.
So we've been making so much of progress towards this COVID situation as country as a whole from US. And what we have been doing right now is we have in so many states, along with President Trump, we have started a phased reopening of the country. And what a phase reopening means, like we have a phase one, phase two, as well as a phase three reopening. And what a phase one is what we are in right now. And what exactly means on phase one is they have classified like the vulnerable population, which is the high risk population, and we are trying to protect them with special measures. So once we do the protection with special measures, so what we do is we can try to start slowly releasing the people into the work community. And so when we do that, we are able to have more people start working so that the economy by itself will not collapse. So right now at this stage, we are doing what is called as a bioeconomics because this situation of COVID is not just the disease by itself. Like you would have heard Trump and other politicians talk about the cure, even Vice President Pence and Governor of Texas, they've been talking about the cure cannot be worse than the disease itself.
Yes.
So it is a very important thing that we need to make sure that we need to protect our community. At the same time, we cannot let the economy of the country of USA to collapse. So that is why bioeconomics is very important, where CDC, Dr. Anthony Fauci, and the Dr. Birx, and all of the doctors, they're forming a health advice task force team that is helping our country to suggest to open up.
Okay, that's actually really I think so. Right now the thing is like before we were supposed to do this show, a lot of people were asking me that what about all the patients have started visiting you, or have you started giving them appointments, or how things are going to be, and how we'll be getting back to shape, because of course people are very much scared coming off their homes. They are like still they have the fear in their heart, in their mind, like, oh my god, if anything happens. So how things are being managed?
So, yeah, the fear factor is a very big portion of today's world. And because the more the fear, so the more the fear they have, it is going to make the situation more difficult. And you see, like the whole world right now is at home, and work is being obstructed, regular life is obstructed. And so in Texas, as per governor's rules, we are going to start the offices by May 8th tentatively. But even though when we say we are going to open the dental offices by May 8th, it really doesn't mean that it is going to be a regular life. It's going to be really, really different. And what we do during May 8th is like we are going to see probably one patient at a time because we cannot create cross infectivity between patients. We ourselves cannot act as carriers. So we're going to see one patient for an hour, and then we're going to give a space where we can clean and prep the operatory room, and then we will take care of another patient with more time space. So what it does is it gives that time for us to technically clean up, get the operatory ready for the next patient. There is also different problems with the PPE, the gears that we use, and the clipping that was first played in the beginning. It actually had a complete protective suit for the doctors. We have to provide it for the entire team. And you can actually, Janak, do you have the other video where I have the entire team, some of like along with my team, they have all geared up. If you can line them up and you can just play it for us, because that will tell that what we are going to expect in the future in a dental office. We will be really geared up. We will be taking temperatures. There will be like some kind of equipments like these, and we're going to put like the temperature, and we're going to check the infrareds using the temperature and or a thermal scan, and we're going to see how our patients' temperature are, and then if they have temperatures higher, then we likely have them resend to the hospitals, because we form like a team of doctors. We need to make sure that if they have symptoms, they need to be really taken care by the hospital. So in the dental office, only symptom-free, we are going to take care of them. We are not sure at this point of time whether we are going to do testing at the dental office. We are not sure. But if we do testing, then we will be guided from our state boards what will be the next set of protocols to follow. But as such, the protective gear the doctors will be wearing will be very different, and the whole team will be so geared up like how you see in the TVs and the videos in most of the places. It's going to be totally different until a vaccine is going to be found.
Of course, yes. Unless and until the vaccine is there, things are still not under control till the time we get that. But as of course, you are into dentistry, but still, I think so. You can. We'll just have a look at the clip. I think so. It's getting ready. Till the time, I just want to have an idea, like how much you are in favor of wearing a mask, like after the situation is like when it is being reopened or unlocked, I should say. So everybody should wear a mask, or is it not that important? What do you think, according to you?
Yeah, I personally think that everybody should wear a mask. And the reason behind it is I think I moved totally out of the frame.
Yeah, that's perfect.
That's fine. Because whenever he changes the frame in between, it kind of makes it very difficult.
Now it's
Actually, can
perfect.
you get one of the masks from the two types of masks from my room? So I'm going to show you also demonstrate the different types of masks.
Yeah.
One of the mask is like the regular mask that you can see everyday use.
Okay.
And I personally think that everybody should be wearing a mask when they go outside, because it's a droplet and it's an aerosol. And it is very important that this virus actually stays in the droplets, in the water particles, in the air for a very long time. So if that happens, it's very important that when we sneeze, it's either like we're going to sneeze on the side, and we're going to wash our hands, sanitizer, soap, as well as we need to protect our mouth with masks. And it is very, very important. And there is N95 respirators. Right now, even doctors do not fully have them. And the reason behind it is the shortage, because it gets soiled really fast. And so we need to make sure that we have enough of the supplies. And if you really see a lot of the doctors, and you can also bring the N95, that is in my box. on the bags. So I'm just instructing my son so that he's going to bring all these supplies for me. So this is actually one of the N95s. Actually, if you read it through, it actually says the N95 here, I
Yeah.
think.
Yes, we can
So
see
it's
that.
KN95. And what we do is
Okay.
this is a KN95, but you see how the coverage goes
Yes.
all around the face, and it is very different than the regular
Yeah,
N95.
yeah, of course.
And these are actually very protected, and this is very important because the particle size, Harshit, there will be the regular masks on the restroom. You can get them. So these are the N95s, but these are different type. The filters are N95 behind it.
Okay.
And this is the one when President Trump talked about the Defense Protection Act, where the 3M is supposed to send all these products only to US. And actually, this is the proof. Actually, this is more of a Chinese version where I was able to get it from one of these Chinese vendors. And but this is a different type of N95, but it is 8 to 10. And this is the most one you actually see on the videos. And what it has is like it is very clean. You can see the yellow straps on them. So this is the N95s, and we just are very limited. Each office gets one box, so we just try to stock up that one box, and whenever we have emergencies. And these N95s, they are worn different. So this is the yellow straps on them, but then it has a whole head way of wearing it, and this is how you wear it. And this goes like that, and this is how you wear and secure it from the back.
Okay.
So this is what is different, and it is going to be very hard for all of our dentists to actually wear them and work with it. It is going to be a totally different atmosphere to wear these masks and work with them because breathing has been very difficult. If you see on the Chinese videos as well as the videos in New York, the doctors show like red marks, all these places. That's because this is elastic band, and it actually puts a lot of pressure around the neck, and you have to tie up your hair and then wear a head cap and then stretch this around and then around the face. It's really difficult.
It's very uncomfortable, right?
Very uncomfortable. And so the patients need to understand the transition what the providers themselves are going through with all these new PPEs. And we are doing these PPEs is not just for ourselves, also for our patients. They need to understand because when we ourselves do not know whether we are carriers. At the same time, we do not want to carry from one patient to other. So these carriers, these protective gear will be disposed once we are working on them. Some of them are reusable and autoclavable. They can be reused and autoclaved as per the instructions from the vendor. But at the same time, we need to make sure that the patients need to understand that we use these different personal protective equipment to protect ourselves as well as to protect them. If we have enough of these supplies in USA, then we will be able to start like a regular routine, which will be very affected right now because we do not have so many supplies. Because in the past, we were supposed to use a mask unless it becomes very soiled. That's when we trash them, like after 2 or 3 patients. But now it's strictly after each patient. So it's going to be a very limited supply. On an average, some offices, we see almost like 20 patients a day, then it becomes really difficult. And if you now see this old mask, this is the old mask. Yeah. So like we do not have too much protection around this mask. There is level 1, level 2, and level 3. And this goes like this. Yeah. So this is like the normal mask. So now you see the difference between a lot of these masks, like how they are so different.
That's great information, doctor. It would be really very nice what you have
Yeah,
said.
a lot of them do not know what we are having and what we wear and why we are struck without PPE. Because this is available, and they say that some coming from bad vendors, it actually, like if you really wear this, and then if you have a candle and if you try to blow it, and actually it cannot be blown if it is a complete protection. So that is very, very important. So we might be able to not able to blow it. Then that means that there is complete protection of the air through the mask. So that way, the air that I am breathing, my patient is not inhaling, and that is what is very, very important for us, because if we are not able to protectively protect ourselves and the patient, there's no point in opening up any dental offices. So we know that we have to take a complete measure to clean up, to sterilize, to autoclave, and to keep a virus-free atmosphere, a bacteria-free atmosphere, along with the standard precautions called the universal precautions, plus the COVID precautions to protect our patients from this COVID-19.
So are these masks reusable?
So these masks are originally not reusable. They are supposed to be disposable. That's the whole thing. There are some masks that have cartridges that can be reused. But because of the shortage, that we are hearing some information that they can be autoclaved, but we are not sure at this point of time. So we've been trashing it out. We don't have a choice. So we are very limited on our supplies. And if we cannot, and we need to, it makes sense if we cannot, if this is already containing virus and we cannot reuse it, we have to trash it. That's the only option. And sterilizable, then we do not know how exactly the virus is killed. I mean, autoclave does help, but it still be anything the doctors would do. We wait for our board regulations. We wait for the OSHA regulations. We wait for the CDC regulations. And these are the three organizations we will follow, and based on which we will be able to do any treatment or do any sterilization procedures at the office. Without that, we would not, without any instruction, we won't do ourselves anything. It's strictly by the CDC guidelines and the OSHA.
And are the pets also affected with COVID-19?
Can you repeat the question
Are
again?
these pets also affected with this COVID-19?
The dogs and pets.
Pets,
I
yeah.
mean, I'm actually hearing to news that two tigers and a zebra has been
And
infected
two cats
at
also.
the
Two
New York
cats.
Bronx. It is there in the news. It looks like some animals are getting infected, because if they say the zoo animals are getting infected, might be they are getting infected because they are getting exposed, either from the zookeepers or before it was from the people that came and visited the zoo. But these animals mostly will be able to recover by itself. And we do not know. It has to be veterinary doctors who would be able to give us more information. But at this point of time, it looks like from what the data is available, pets can get infected, but we do not know. And this is just based on the media and the reports that we are receiving, that yes, pets have been having infections. There was one interesting article about a dog of a COVID-19 positive patient in China who was also testing positive, and the dog was taken into quarantine from the rest of the family. And then after this 14-day period, I mean, the dog was taken back into the home. So it looks like, yes, it can get infected, but like I said, I'm not a veterinarian and I do not know much of the data, but it looks like it from what we hear from the media. And it is so important. That's why I have instructed that to my son, that my dog should not be taken out of the home, but go have him walk at the backyard.
Yeah,
Because
that's wiser.
other than us, nobody comes to the
Correct.
home at the backyard. So it's always better to have the dog walk at the backyard rather than on the front yard. I mean, it's just a small common sense thought. Yeah.
Of course, that's really nice. But you know, common sense is very uncommon sometimes. So it's very important. Some tips really help, and we need to take precaution. And pets are a family, so we should be very precautious. So you were showing me something on screen when we were supposed to start the show. So I would like to
Yeah.
know
Before
about
that,
that.
because you were talking about pets, I wanted to introduce myself to Jenny. Jenny is our. Do you hear him?
Yeah, of course. That's so cute.
So this is our little pet at our office, and we use this for our most of the time the fussy kids that do not want to open their mouth, that do not want to And so what we do is we give this little kid, whoever is crying, whoever doesn't want to get their teeth clean, we give them our little Jenny, and he's our member of our team. And Jenny used to keep them very busy and diverted, and by the time we clean their mouth.
Awesome. So before we continue, let's run a clip of yours. Yeah.
Sure, sure.
Together, we stay united
Together we stay united
in social distancing
in social distancing
to protect our community
to protect our community
and our nation.
and our nation.
God bless America.
God bless America.
God bless Texas.
God bless Texas.
Thank you.
Thank you.
Wow. Very inspirational and very nice. And we need to make sure that everybody follows the rule and maintain social distancing. And that's the only way we can fight with this disease. That is very, very important. So hopefully things will be better, and looking forward that things should be fine. So
Yeah.
anything you want to show me on the screen, doctor, before we were starting the show? Can I have a look at that?
Sure, sure, definitely. So this one, let's see. I think. Okay, so here I'm going to show you how the scanning system works.
Yeah.
Can I have my son here? So we use an intraoral scanners, and there's different types. And what we do is so let me glow up. Okay. So we try to, instead of using an impression, to take a model of what's there in the mouth. I'm just going to show you because it has a little bit of a lag between scanning his mouth and showing it here, but I'm just going to show you how we scan, and then we go inside and we go scan like that. And it is very easy, like a 5-10 minute job, and then we just totally scan. And in minutes, in next time when we are at the office, I'm going to show you more of it. But this is how immediately the picture goes on to the screen.
Okay. Oh, perfect.
So-
Perfect.
So wherever we need to make a crown or a cap, the picture gets automatically scanned into the computer in the mouth, instead of spending so many hours sitting and trying to put a gagged impression in the mouth. So a
That's
small
great.
scan tool it's just like an intraoral camera, but like it's very fast. It scans into the system and it goes immediately into the lab. It can be like sent directly to the lab. So what happens is our time frame to take the data, to let it set, to let the material shrink, and then we pour the model and then we transfer it to the lab, it is all shortened. And it just makes it very, very easy for us to cut down the time to have it more accurate, because like if I have to expand one spot, I can click and I can rotate,
Yeah.
and then I can see the under part of it, and then it is so easy that I will be able to correct if there is any problems with whatever we do in terms of work. And once we fix that, we are able to give them a more of an better prosthesis for our patient. Like in the cap wise, they will be able to bite better. They'll be able to accommodate and rehabilitate with these crowns better. So it is a more advanced technology now we use in our offices, that we are providing more of a better improvised care. And the more technology we incorporate in our practice, it makes it really, really helpful. And I also want to talk about a little bit of the reverse approach model that I formulated for this
Sure.
COVID-19 situation.
Yeah.
And what this reverse approach model is, I had categorized the vulnerable population. Vulnerable means the high risk population, people who can get affected by this COVID-19, into 7 categories. The first category is the nursing home and the long-term care facilities. And then another category is the people who are 50 plus. The first one is the geriatric people who are already older, and they are more prone to these diseases, the infection of COVID-19. And then another category is the immunocompromised patients. And those people are at a higher risk. Those who have cancer, those who have HIV, those who have other birth congenital problems, like, they have some issues with their heart, their lungs, those people. And people who are 50 plus also have a higher predilection if they have on any other medical condition like diabetes, or they have some thalassemia major, or like blood conditions. And also some people of certain origin, of certain African American or certain types of races, they have a higher predilection. Plus athletic people who aggressively do athletic and involved in sports, plus the people who are in the gym, like gym addicts. I actually put them in the classification because if you work out in the gym for an hour or so, it's okay. But some people, they go crazy and they spend their entire day in the gym. So those type of people, they have an altered lung function, so which puts them at a higher risk. Anything little or anything reasonable time frame is always good. Anything too much is not really helpful.
Yeah, extremity is always bad, of course.
Yeah, extremities are bad. So those people who are, like, I call them as gym addicts, as well as those people who are frequent flyers. We have a very interesting case in Houston where I just don't want to disclose the name of the patient, but most of the Houstonites know that this particular patient is having positive COVID, and he is being in ventilator. And the reason behind this is he doesn't have any of the conditions other than him being a frequent flyer. He had been frequently flying and been in airplanes. And so what happened was he's in the ventilator for the past 2 weeks, and our prayers are with him and his family. And his family, his kids got infected, his wife got infected. So it's been, we really pray for him so that he would get healed from the situation. He's pretty young. He's like 40 plus. He's not even in his, I don't think so. He's very old. So it's just that frequent flyers have a higher predilection, not just based on this one case, but like when we really look into the whole category of the patients, the sample size which we are looking in, there is actually a higher predilection for the people who had been more actively doing some aggressive exercises, not regular, but aggressive exercises. And also people, very simple category is the last category is doctors. Yeah. They are vulnerable because we are directly exposed to the higher viral load. So it puts the doctors themselves in the 7th category. And so I had formulated how to protect each group of people. And I made sure that this type of formulation has reached to the governor of Texas, to the President Trump, to CDC. And also I made it available to a couple of states where they formed pacts. And like the Western Pact, the Midwestern Pact, I am still yet to send it to the Midwestern Pact. But I've also reached out to Governor Cuomo in New York. So, I mean, I'm just trying to make my theory available to as much as people possible so that it would be of some help to the community.
Of course, that is so true. And I'm really hoping, doctor, like, it's really a stressful situation and worrisome situation still going on. And you have always been a great help to us. But being a doctor, I want your opinion about doctors. What do you think? What state of mind you are in? Our viewers want to know about that. How you are feeling?
Sure, definitely. And I would like to have Janakji play that other Texas clip also. Yeah. It actually will tell me my face expressions, what I'm talking about when I was driving the car. And actually the clip even says celebrating Texas, because I have been trying to make sure follow every protocol whenever I am exposed to a patient, and making sure that I am not transmitting the virus, because at this point of time we do not have tests. And symptoms are like the symptoms of temperature, symptoms of running, like not really running nose, cough and sore throat, or any respiratory illness is what we are looking for at this time, because testing is not really completely available. Another thing is I hear testing and testing and testing, and a lot of governors and a lot of politicians say that we do not have enough testing. And whatever the videos I am making and I am sending it out, it does not really talk about testing. And the reason behind it is they really do not know if the tests that is like, it is getting the test, is everybody doing the right tests? Is the test very accurate? if we are able to follow, even if somebody is tested positive, are they really quarantining themselves? Like there's just so many questions in and on them, but it is very important collectively as doctors, we have to take safety precautions. That is what is important to protect ourselves, to protect our patients, to protect our families, that we are not taking them back home. I do not have any fear. And as a matter of fact, I would request everybody to remove fear from their minds. It has been stressful. It's really stressful to go through this situation, but stress and fear reduces the cortisol formation in the body, and it is going to actually make the problems more aggravated in our body. The immune response is going to be more diminished. So if we want our body to fight this infection very well, then I would really want us to be staying strong, staying confident, staying more, be like, yes, I'm going to stay strong. I'm going to fight this virus. I'm going to win this virus. I want to prevent it from getting it. But in case if I get it, I want to stay strong to make sure that I wouldn't end up collapsing myself. I would fight through the disease. Another thing is, before in the past, we do not know how much of junk food we ate, how much of unhealthy lifestyle we had. At least right now we are at home. We can try to practice eating healthy cooking, healthy living, doing some good exercises and yoga, and doing some physical activities that will keep having an active lifestyle than a sedentary lifestyle, will make ourselves more immune and be able to face this virus even more better. And this whole phased opening of the government, it is going to help our people. And it is very interesting that I read and also heard from the news that NASCAR, the car race, they are expecting that the car race will be starting in the full-fledged like in the past, might be in 2021. And to hear that, people would be like, what? And it just gets into a scary thing. Same with the concerts. They are expecting the first normal concert with full-blown stage might be in 2021. I heard, I also keep watching Trevor Noah's Daily Show and Ms. Ellen's show, talk show. And they've been saying that, yes, they are expecting their normal shows, their talk shows will be with full of audience, probably March 2021. So one important thing is to be knowing what is happening in the news, not to get afraid, but keeping ourselves updated as well as getting ourselves prepared. Preparedness is the key. And it is like, okay, this is like a new war situation. How are we going to prepare? How are we going to protect? How are we going to act? And this is what is very important. And once we make all these formulations in our mind, we try to prepare, it's totally a different approach, and it's a totally different lifestyle you'll be following, and it's a totally different new perspective of life. But we are human beings, and we should be able to manage it well, because it's always Darwin's theory of evolution, the survival of the fittest. So the more we adapt, the more we evolve, the more we are successful as species. So this is the time we stay united in social distancing and fighting this virus.
Yeah, time is short, but I would like to take one call of our viewers. They have just called and asked that she missed too much in stress, and can the stress be affecting her teeth? Like, is it connected with each other?
Yeah, stress can affect our teeth, and it is going to be having an impact. Like I've been saying in the previous videos too, it is people are coming and calling with cracked teeth, broken cusps. It is affecting the jaws. It is actually affecting the jawline because they're clenching more. And I've been telling them to do some jaw exercises, being more, having a relaxed mind, and taking some jaw exercises, stress relief exercises. They're all going to help.
All right. Thank you so much for your info, doctor. And we want you more and more on our shows. And please take out some time next week also. We can have one more show because a lot of people keep on calling. And I think so we can keep it open for our viewers and they can call and talk directly with you.
Sure, sure. Thank you. Thank you so much, Rashmi. That was nice catching up with you.
And stay safe, stay home. And it has been a great help of yours to all our community. Always you have been guiding from the time this pandemic is happening, and you are with us. Thank you so much. Thanks for your great support, and salute to you again. Thank you.
Thank you,
Thank you,
Rashmi.
doctor.
Thank you. Bye-bye.